Hello, my name is Macy Shumpert, and I'm a physical therapist assistant student with the CASH PTA program. I have conducted my article review regarding a randomized controlled study on the efficiency of soft tissue mobilization in babies with congenital muscular torticollis by Keklik and Weiger from the 2018 Journal of Back and Musculoskeletal Rehabilitation. The purpose of this study was to determine if using soft tissue mobilization to treat CMT in babies with mild and moderate head tilt was effective in enhancing symmetric posture of the head and neck. This research was conducted because there were various studies on methods for treatment of congenital muscular torticollis, but there were no randomized controlled studies on the effectiveness of soft tissue mobilization as a treatment option. 29 babies with CMT between the ages 0 to 6 months and a head tilt of 5 to 20 degrees were randomly assigned to two groups, a control group and a study group. Both groups received a baseline home program including positioning, handling strategies, strengthening and stretching exercises, and environmental adaptations. However, the study group also received soft tissue mobilization by a physical therapist 3 times a week. 3 phases of STM were used to release the neck muscles and fascia of the study group, and this method could be modified according to the baby's tissue tension. Neck lateral flexion and rotation were assessed via the muscle functional scale, head tilt, and range of motion measurements. Both groups were evaluated before randomized assignment at 6 and 12 weeks during the treatment period and at 18 weeks after the initial evaluation. At initial comparison and after 12 and 18 weeks, there were no differences among the two groups. However, after 6 weeks, there was a significant difference between the control group and study group in head tilt and neck rotation. The study group provided better results at 6 weeks in assessment of CMT. Mobilization techniques are preferred for infants, and application can be gradually enhanced or reduced according to the subject's response during treatment. The effectiveness of soft tissue techniques had not been established for infants because there were not enough controlled randomized trials related to STM methods. However, the results of this study proved that STM and the home program were effective in treating CMT. Some limitations of this study were elimination of bias wasn't guaranteed, the muscle functional scale wasn't appropriate to evaluate babies younger than 2 months, and results were valid for mild and moderate cases, but more severe cases could not be generalized for. This information is useful to me as a PTA student because I'm interested in working with pediatrics. Also, I had the opportunity to observe a therapist specialized in pediatrics who works with patients who have been diagnosed with CMT. Thank you.